Good morning to you all from USA Duquesne University, and it's morning 9 a.m. here, and I wish you a good evening in India and beyond. Yes, and today Dr. Urmi Ashar will be speaking about leadership in healthcare and all your opportunities in USA, and we will get to know her university, and know all the other people and everything. We are here to support you. And without any delay, I will hand over to Dr. Urmi Ashar. Please, good morning to you all once again, and good evening in India and beyond. And please welcome.
Thank you,
Thank you.
Dr. Shiva. Uh, I really want to appreciate the efforts that Unidemi team has undertaken and Dr. Shiva's leadership in bringing us to this point here and now so that I could share my journey. My story is just like yours. I just started 32 years ago. That's all that there is a difference. I come from, a really regular middle class family. My father was the first one to go to college and study civil engineering. And I am one of the, oldest siblings in my family. And it's what ends up happening when you focus on your education and you see things around you and ask the questions. So I kind of request you all that as you're listening, your goal is to craft your own story, your own narrative as you are hearing me talk. Okay. Jeff, can we go on to the next slide, please? So, this slide talks about boards follow doctors' advice. What are boards? You see another logo there, National Association of Corporate Directors. All the big companies like Tata Industries in India, they all have corporate boards. And at one point in my life, I was advising boards, I was teaching boards on how to govern. And you might wonder, what does a MBBS MD doctor have to do with teaching board governance? And for that, I'll kind of get you to the point of Bhagavad Gita, the point that is made in there, you are what you believe in. You become that which you believe you can become. So for just 30 seconds, close your eyes right now, wherever you are sitting, and think about, what has brought you to this point here and now, because your journey in coming towards the end of your MBBS has not been easy. I know because I have been there. It has been a really tough journey, right? Jeff, can we go on to the next slide? So here you can see, these are the two people responsible for who I am, my parents. I'm this little one over here. I am sure all your family albums have these kind of pictures. And the question you have to ask yourself is why you took the decisions you took up until now, and how will you take decisions moving forward? So I started with middle class roots, and my father had the vision. And remember, I was growing up at a time where there were very few options for girls. I even remember, as a 6-year-old sitting in my father's lap when he would read the Times of India, and on the front page, there was a story about Indira Gandhi and there was a dowry related death. And I had asked him the question, Dad, are girls powerful or are they weak? And my dad had, in his wisdom, said, it is all a matter of perspective, little one. You have to think in terms of, when you see a wall, is that a barrier to keep you away? Or is it a barrier for you to become better and learn how to get stronger to scale that wall? So I would invite you to come to this point with that mindset. It was not easy getting into medical school, but once I had made up my mind, I applied myself. I didn't grow up. So I didn't grow up in Mumbai. I grew up in a very, very small town close to Mumbai. It was a company called Century Rayon that my father worked for. And one of the key things that I had realized was it was easy studying if my friends studied too. Otherwise, I wanted to be in mischief mode. So what did I do? I decided, at around 10th standard, you kind of start getting a sense. What am I going to become? People ask you questions. What will you become when you grow up? And I looked around and I decided, in my town, it's the doctors, not the company CEO, not the presidents, the doctors who held the community together. When people had a tough time, they went to their GP. And I decided, okay, I can see myself doing that, and I'm going to become a doctor. And I remember everyone's like, you're so full of mischief. Are you ever going to have the time to sit still and study? And I did it. And not only that, but we were the first batch where all 15 of us got into our choice school of engineering or medicine. And that to me is the crux of leadership. You bring out not only the best in yourself, but you bring out the best in others. And that is the journey. If you learn those little aspects, you will catalyze your global ascent. And when I kind of reached a point, even in the United States, when I came to study, one of the key things people would ask me, why are you doing what you're doing? At that time, I didn't know. But the knowledge I had gained helped me, help my father. You'll see here, he had Alzheimer's. The last 7 years of his life, he had Alzheimer's. But because of my insight into health systems, I was able to lead my family. My family is closer and stronger today, even though we are on 3 different continents, my sister, brother, and I. And I was able to create Aram Medical Center. You can look it up. Aram is in Mumbai. It is also in Pune now. And Aram has 3 centers in Mumbai. And I was one of the first people who had started conversations that, middle class families, in India, we don't have healthcare systems. We are not living in Mumbai anymore, but my parents need help. What good is my education if I can't help and change the way we do things? It just starts with that, and your education can help you do that if you learn to think in terms of systems. Jeff, can you please advance the slide? So the world was very different 30 years ago, but the dynamic still remained. United States was one of the top countries. And I can see Anoop nodding his head, and it's because we all recognize we are all from the same generation. United States was the land where, they know what they're doing. And in India, we had chaos and, problems. And today, too, you'll see that, in healthcare, India is ranked at 112. United States is at 37. Look at the life at birth expectancy. In India, it's 63 to 66 years, whereas in the United States, it's 76 to 81 years old. The health spend as of GDP, gross domestic product. If you were in my class, I would kind of expound on that. Yes, it's not an economics class, but you know, in healthcare, if we don't understand this concept, we don't know how we are doing our jobs. The health spend percentage, it is 17% of GDP in the United States today. And the out-of-pocket expenditure is, you know, in India, it is, you know, 70% of Indian population pays out of all their medical expenses out of pocket, whereas in India, it's only 10 to 12%. And that has an impact in how we practice medicine and where the world of medicine is going. Jeff, can you advance it to the next slide? You need to understand that India's challenges are the big urban and rural divide. Out of pocket expenses are high. We deal with, in India, we deal with communicable diseases, tuberculosis, malaria, right? Quality of care is very inconsistent. I am sure if you look across, even in Mumbai itself, the quality of care in in King Edward Memorial Hospital, which is my hospital, KEM Hospital, is very different from the one you would get at Grant Medical College. And then there is this last 5 years has taught us pandemic preparedness. I mean, we are all very vulnerable to outbreaks. Is the story very different in the United States? Not really, but we also have other issues which will come. You know, we are now a global economy, so the same story comes across. It's just like a contagious disease. Cost of healthcare is skyrocketing. Inequality is insidious. Even in India, you know that there is a socio-economic divide that has really become very big. There is administrative complexity. So as bureaucracy increases, decision making goes down. We are struggling with drug addiction and substance abuse in India, in United States. These issues exist in India too. And then there is mental health crisis. You recall in India, there were this farmer suicides. And right now, physician burnout is at the highest in India as well as the United States. So we have some shared challenges too, which are front burner issues, which is diseases that have kind of come to the forefront because of the lifestyle, you know, the kind of diet we undertake. We drive everywhere instead of walking everywhere. I mean, when I was your age, I used to walk almost 5-6 miles, you know, a day. That doesn't happen anymore. People drive, right? So because of that, we have issues like obesity. In the United States, we've been struggling with obesity, but now obesity has become a big issue even in India. And those issues cause other lifestyle problems. So we are also struggling with trying to figure out what kind of technology adoption is going to help us and the global health risks. We already talked about quality of service and the human resources issue, which is shortage of trained staff. So these are all the big challenges that we are facing. And just studying medicine alone does not help you. You need to kind of understand the whole systemic perspective. And how are you going to manage? I mean, if you start a hospital after you finish your internship and you can't find someone to work as an orderly in your clinic, you're going to be hamstrung. You're not going to be able to do your job. So how can you resolve those issues? Jeff, can you move us to the next slide, please? So my formative experiences started at St. G.S. Medical College, KEM Hospital in Mumbai. I have also worked at Tata Memorial Hospital extensively, after which I had started my own anesthesia practice. Uh, you can see, Dr. Shiva, they're going to get the slide deck, right?
Yes,
So,
yes, they will.
yeah. So you'll see all the different things that I was exposed to. You're doing your internships right now, right? Or will be doing very soon.
Yeah, some of them are undergraduates and some are into their final year. Some of them have completed their internship. So they are all in that group. Yes.
Yeah. Every experience matters. The work I did in rural hospitals, including the work in the red light districts in Mumbai, they all added up because your brain figures a way. You start understanding experiential education is the foundation of everything. So take your experiences in internship seriously. Don't spend all your time whiling away because it's just internship. There are no more exams. We are done with exams. This is where your experience begins. You will not believe how many times I have had to recall my work in the leprosy clinic in Mumbai to explain a certain public health issue or how the disease progresses. I also was at the forefront when I started my labor analgesia practice. So I have done my MD at KEM Hospital too. It was in anesthesiology. And I came to the United States. The first time when I came, it was on a fellowship. I studied anesthesiology over here, labor analgesia. And I went back to India and I started my first company at that time called Birth Matters, and it was all driven to bring about change. It was in the Juhu area where most of the people from Bollywood live. So many of them were my clients. uh, Bringing about change is interesting, and once you kind of get smitten by that challenge, you will realize nothing matches up to it. So if you undertake the health management systems, you too can be a change agent. Some of the issues that I have, been at the forefront is aging care. So Arambaji Care Center in Mumbai is one of the things that I had started. I'm still involved with those people because my father passed away last year, but I'm involved because, there are so many other families just like mine whose children are globally spread and the parents are in India and need help. I was involved in a child malnutrition issue, which was a multi-sector collaboration. It was folks from MIT that I got involved with, Peter Sanjay's group. And did you know that India spent the highest amount on trying to solve child malnutrition globally, and our outcomes are still poor? And from that was born the issue of Bhavishya Alliance. You can look all that up. It's still those, they were all these initiatives are almost 20 years older, but they are still alive. That's how you will kind of start thinking. Before we started, Dr. Shiva and I were talking. It's not about us. It is about what positive change. Because you are present here and now, how are you going to improve the lives of people around you? And that is the essence. As doctors, you are the leaders and the cornerstone of your communities. Jeff, can you advance us to the next slide, please?
Yeah, if I can intervene, I
Mhm.
just want to tell or talk or say to our young doctors in India that being a physician is not just about sitting in a clinic and just taking one patient at a time. The advantage of coming to USA, doing your masters in administration, in management, and in understanding the global issues, and being open to or exposed to how the things are done as a leader. Now,
Correct.
a doctor, we are trained. My mother doesn't understand what I do because she doesn't see me sitting in a clinic giving injection, and that is her concept of being a doctor. Now, most of the doctors, In India, now they understand that they can do many other things. You have got opportunities to serve as leader. And if you are a leader of a hospital, there are 200 doctors and 2,000 nurses working for you. So I want you to understand that by saying change leader is like you bring the change and you become the leader by showing others how things are resolved. And why we become doctors? To, of course, take care of the health. But by being leaders in healthcare system, you take care of the entire society and you really make what you call a little bit sowing of that spirit which changes lives, not one at a time, but colonies at a time, places at a time. That's what
Populations at a time.
population, yes. And the idea of being a leader doesn't mean that you're just focused on one clinic, but you affect thousands and millions of people at the
Exactly.
same time. Just imagine every year there are 2 million people coming out of India to other countries. And just like my mother and father, I needed so much help. Even to this day, my mother is 90 years. I have to literally beg people to go and take care of her. So these are all the problems of the future
Yeah,
where
and
you
I
will be trained.
helped my mother and
Yes,
father with Aramedic, Aji Care Center, had I not been, introduced to a systems way of thinking.
yes,
That my family is facing an issue, I'm sure others are. This is the public health and health administration approach. You start going, okay, is this a population based issue? If it is a population based issue right now, no solution exists. How am I going to solve this? So as doctors, you're leaders, you're also entrepreneurs. I serve at the National Science Foundation's review panels in the US today. And when I was in your chair, did I imagine I would be doing those things? No. But I decided to walk through a door when I came here for my labor analgesia, training. That was the first time I was like a kid in a candy store. Holy cow, there is this whole new world, and I have a chance to play at a global stage. And with me, I'm inviting you guys to come because you know, we are soon going to get old. You guys need to take the leadership and onus of starting to solve these problems. So it's that plus, in Pittsburgh, we have a very interesting hub, technology overlapping with healthcare. We call it Health Tech and Meds Revolution. So this company that I was involved in, Humotech, I was the managing director of that company. What that does is it's a robotic platform that allows. Has any of you, seen a prosthetic foot? Um, there was that dancer, remember Jaya
yes, yes,
Chandan?
yes.
Yeah,
Yeah. She was
and
a South Indian dancer. Yes.
correct. And she had amputated. Was in an accident and lost her limb. And from that emerged the Jaipur foot. Well, the world has evolved quite dramatically since the Jaipur foot. And how are we going to figure out which foot suits which patient? Humotech is a robotics platform that allows us to not waste, because each foot costs like thousands of dollars, not rupees, dollars. And how are we going to make sure that people get optimum usage and functionality from the foot without wasting money? Humotech is solving that problem. So there are all these, there is a genomics revolution going on. I mean, you all familiar with side effects of medication, right? Did you know that there is a pharmacogenetic basis to that? And if you come here, you are going to be at the forefront, and you can, choose to stay here, go back to India, but you'll make a difference. That's how you make an impact. Uh, Jeff, can we go to the next slide, please? So you saw in my previous slide, I've taught at many different universities before, Carnegie Mellon, I have taught at Pitt before. And why do I teach at Duquesne today? It was simply because of, the persuasive powers of Dina Kinsey and Dr. Linkoff. They invited me to, start, create a curriculum for leadership in our health administration program. I realized that the school, the whole university takes its mission very seriously, that they want to educate ethical healthcare professionals. Ethical is important. We are all familiar with the concept of dharma, right? We
Yes.
want to be just. And, as the world is going nuts and bananas, there are wars everywhere. And we are going to be facing climate change challenges too. How can we remain ethical so that we do not leave any population behind? And that mission is uniquely, important to me because that is how my father had raised me. And I have never done anything because, there is money involved. I wanted to make a change. Money comes by itself. You're all probably familiar with our mythology that if you try to hold Lakshmi too hard, Lakshmi escapes.
Yes. So make
So
Saraswati your friend. That is the
make
most important thing.
Saraswati your friend. Yes.
Yes. And then
Lakshmi
Lakshmi
will
will
come.
be jealous and she will come and join you. And as you are saying about Dharma, today is such an auspicious day, Krishna Janmashtami. And I'm so happy that we are all meeting this beautiful day. And then you said that it was all the people who brought you to Duquesne. I also say that Balaji has a hand in bringing you to Duquesne. And I want all the listeners to know that Pittsburgh is the place, the city where one of the oldest Balaji Tirupati temple is in that place. So we're all very happy to be associated with our own gods, and the temple is beautiful, and you will see that. Please, thank you for giving me a chance to talk about it. Go ahead.
Yes, of course. So, Jeff, can we go on to the next slide, please? So I already talked about some global challenges, pandemic preparedness, chronic ailments, promoting universal health coverage. I believe Bangalore is the hub in India for that kind of shift happening, led by Devi Shetty.
Um, Dr. Rami, I think your mic is muted. Could you please check it?
So, uh, promoting universal health coverage is really, really important because if people do not have health insurance, you all saw what happened during COVID. If you lived in a very affluent, community, gated community, were you still secure from COVID? No. Our fates are all interconnected because disease knows no boundaries, whether it is, wealth or, where you are in the society or hierarchy. So we need to make sure everyone stays healthy. There are mental health issues. This crisis is going to bring civilization to its knees, and we need to make a inbound road into that. Mental health challenges are is also intricately linked with physician burnout and clinician burnout. I am sure that you are all aware of the stress and challenges. Today, doctors are facing, even in India, there is very low trust. People come and beat doctors up, right? So, my friends from my medical school are talking about it all the time. You can sit and complain all you want. That's not going to change anything. You've got to do something about it. And that starts with you becoming and taking your responsibility as a leader. Climate health challenges, the refugee crisis and the migration, human migration is at its height today. And this is going to test the existing systems, even in developed countries. We need to improve our disaster and conflict preparedness. Microbial resistance, rampant use of antibiotics has caused, antibiotic resistance, tuberculosis on the rise. MRSA infections are on the rise. And how are we going to incorporate the technological innovations to improve the care we provide? Because we are no longer providing care the way we used to when I graduated from medical school. And I have decided to dedicate my life to making sure that human beings are at the forefront of this AI revolution too. Because, when you think about AI, people think, oh, magically, AI is going to, ChatGPT will give us the answers. Well, no, who puts all those answers in? It's us humans. And so if human beings continue to do their stupidity, AI is going to become more stupid too. So we have to figure out how we are going to improve our intelligence together and be the leaders. Next slide, please. So how much are we spending? In the United States, we are spending $4.3 trillion. You know how many zeros in a trillion? 12 zeros. That's how much we are spending in the United States. And the amount of spend is going high. You see this curve, it is going up. It is now reaching a point where inflection point where the increase is going to be logarithmic. To give you some perspective, the GDP of the entire country of India is 3 trillion. US is spending on healthcare alone more than India's GDP. Jeff, next slide.
Yeah, Dr. Urmi, I just want to let you know that there are doctors joining this webinar from all over India and beyond, and they are enjoying it. They are sending me through chats and messages that they are very happy to hear you, and then, of course, they will be listening to you again. And I just thank them and thank you, and I'll please continue. And I just want to update you.
Invite all these doctors too to
Yes.
join this revolution that we've started in
Yes.
UK. How are we going to get doctors to become leaders? The US spend is the highest amongst all the whole world. This is, the developed nation. You can see the red. United States is spending almost double the amount. And I ask the question, what are we getting for it? Does spending more money get us good quality? No. Jeff, can you move us to the next slide, please? And you'll see here, avoidable deaths per 100,000 people in the OECD group of countries. And this is the United States graph. It is actually, all the countries are going down. The more you spend does not normally result in getting good quality care. And it is coming down. This is the graph where you're seeing how many deaths occurred. Jeff, back to the previous slide, please. Yeah, this graph tells you how many deaths occurred in COVID, and US, with all its spend, still experienced that many deaths. It's one of the highest amount of death. Maternal child, deaths, infant mortality. US is way higher than the other OECD countries. So in spite of spending more money, we are not getting good quality out of it. Jeff, can you move us to the
Yeah,
next slide?
I also want to intervene by saying that there is a huge shortage of healthcare workers in the United States. And today, as we see, if you want to make an appointment, the waiting time is 2 to 3 months. And that also is a great opportunities from other countries like India and others. These doctors and healthcare workers can really come to USA and then flourish because there is a huge need, and that vacuum, I don't think we can fulfill everything, but by helping others to come into Duquesne and come into US, that would be really helping the healthcare system in the United States. Yes.
Yeah. And, there are opportunities across 5
Yes.
domains. We have to solve access to care issue. You saw developed countries and developing countries, they all have this challenge of access to care. We have to improve our care processes, and it happens only if we as doctors care about the process. We have to improve our administrative efficiencies. We have to solve the equity issues. And most importantly, healthcare outcomes, spending more money. You saw India spends the highest amount on infant mortality, it doesn't get good outcomes. United States spends so much more, it still doesn't have good outcomes. What does it tell you about us as physicians and clinicians? We've got to take the lead in solving this. Next slide, Jeff. And there is a big issue with and problems with access to care in rural areas. It's the same in India and United States. More than 60 million Americans live in rural areas, 1/5 of the population. There are challenges. The population is getting older, population is getting sicker and poorer, and there are vulnerable people. How are we going to resolve the issue of provider shortages? Rural hospital closures are on the rise, and there is, shortage of emergency services being provided. So there is a lot of work to be done, and I invite you to join us at Duquesne as we start solving these problems. Jeff, can you take us to the
Yeah,
next?
and I also want to add to that, because of 60 million people in the rural areas of United States seeking healthcare. This also gives our doctors in the India and beyond to really make an effort to get into USA, get through the USMLE, or if you're not uh, interested in pursuing PG or MD, you can do your master's in health policy, healthcare, health administration, whether it is pharmacology or research, clinical research, setting up labs. There are a million ways you can be a part of United States healthcare system. So all the doctors who are participating in this webinar, also those who are connected with other medical colleges and students, please share this with your doctors, with your students, and with your colleagues, and make sure that they have a great opportunity coming to US and then working and taking this technology advances, drug what you call advances, and going back home, spreading it to your own population. Like maybe after 30 years, I still have so much love for my country. It doesn't stop me. And it
Correct.
doesn't stop Dr. Urmi being in love with your mother. And
Yeah.
our motherland is so important to us. I guess there is not a single day where we don't think about our mother. So what we learn, we are global. We take the best practices. We take the best management skills, and we take the best technology and then spread it, take it. And if there is one doctor in one town who comes to America and goes back, he would be really helping that little town. And that is what our goal is. Thank you so much. Please go ahead, Dr. Urmi.
Yeah. And this is, the priority even. So in India, we have our health minister, right? In the United States, the system is more systematized. We have the Center for Medicare and Medicaid Services and the US Department of Health and Human Services. Both these agencies, and it doesn't matter who's the president of the United States. These agencies have seen the underpinnings of where the world is headed, and they have realized that the 5 key priority areas, the foundation is health equity, and CMS's framework for reimbursement is also changing. So this is a very good time for you folks to come here, understand how to make systems level change and be a part of it, so that just like I was able to, help resolve the issue by starting Arambaji Care Service, you will be able to solve the problems for your own hometown once you have this global experience at the world stage. Jeff, next slide, please. And the reason why we have reached this point where throwing more money at the problem doesn't solve the issue is because healthcare organizations and healthcare systems, not just in the United States, but the world over. If you look at the UK, National Health Services, NHS, is facing the same problem. You will find if you look through, case studies, China is facing similar problems. India is facing the same problems. We want to approach things from the systems perspective. So at Duquesne, we have kind of really embraced systems thinking into our curriculum. You approach problem solving considering the larger picture. You're not just dealing with an individual. The individual lives within a society, and the society is within the environment. This is where policy level changes happen. And so we have to have a multi-pronged approach on how we are going to solve the problems. And we have to do that with an understanding of complex relationships and patterns in a system. Because very often in complex adaptive system, you enter and push one lever in a system, you get unintended consequences somewhere else. So we have to become more mindful about that, and this systems thinking is the path forward if we want to improve the healthcare system. Jeff, next slide, please.
And fortunately, the doctors, right from day one, they are into systems thinking, like we study systems, we study limbs, we study tissues, everything is in systems. So the same principle of systems is now applied into solving problems in the society. And now system thinking is up and running like what, more than 20 years now in USA, and everybody talks about system thinking. And I think doctors really, knowingly or unknowingly, we are trained to balance the equilibrium or the homeostasis of our body. And that same systems thinking should be brought into society and amongst all ourselves. And that is what system thinking means.
And why do we care about health disparities? Just like what Dr. Shiva was talking about, if I have an infection in my thumb and I ignore it, it festers and festers, and probably I have diabetes too, and everything mingles together. My blood sugar is not under control. And then this infection eventually turns into septicemia. So that is the reason why we have to pay attention to social determinants of health, where social determinants of health are the foundation of how, disparities get manifested and health outcomes. So here you see, when the healthcare costs exceed the GDP of a country, and United States is right now, already there, it is going to be very, very difficult to get anything new done because there is no productivity. People's minds kind of are down. So we, the doctors, are responsible for now turning society around. Next slide, please. And this slide basically talks about the multi-causation disease model. Yes, your genetics play a role, but your personality and beliefs and behavioral choices, doctors play a big role over here. And with our leadership approach in health management systems, we want doctors to also play a big role over here. How are we going to impact the environment, the economics, the policy making at a larger stage? Next slide, please. So this is another, CDC. CDC led the world with the response to COVID, Center for Disease Control. CDC has realized this idea that One Health is the only way forward. All health of the people is interconnected, but not only that, our health is interconnected with the animal kingdom and the plant kingdom. And if we don't pay attention to that, and we just focus on our own self, me, it is going to come back to bite the me. Jeff, next slide, please. And One Health initiative at the CDC focuses on the current issues where dense population, think Mumbai, India, people live so close together, or think New York City, they face a different kind of health challenge. Changes in climate and land use. Right now in the United States, we are facing, problems because of climate change. So is India. The heat index is jumping through the roof, and it's going to have a big impact. At the same time, there is, no country is functioning only by itself. It's a global stage. You all saw what happened when we, in India, we decided we are not going to allow for, imported computers. There was pushback, right? You can't, the genie is out of the bag. I don't know why, because I'm not doing anything on my end. So, Jeff, next slide, please. So our program is focused on building unique leadership skill, navigating uncertainty, complexity of healthcare, and taking into account strategic thinking and systems thinking. A prime example would be, you all know this man, right? Devi Shetty.
Yes, yes, of course.
Yeah.
Yes.
He makes a very interesting point. Jeff, can you play the video, please? We can't hear the audio, Jeff.
My apologies. You said you cannot hear the video?
Yeah,
No.
now.
Ermi, I'm going to take control back of the.
Yes. Please.
They're paying $1,200.
Is that playing now?
Nothing
Yes.
in this world in service. What was $2,000, 26 years later has come down to $1,200. It's only by economy of scale. Today, we are privileged. About 12% of the heart surgery done in India is done by us. So we have the companies which supply products, they look at us differently. And we have converted our hospital as an academic institution. Every hospital we build, we treat it like an academic institution to train young people. And more than anything else, we are very, very conscious of the quality. The cheapest way to produce something is to make it the best in first attempt.
Why is that?
then you don't have to repair it again. If you fix the heart properly during the first time, you don't need to take back the patient for a re-exploration or give them massive quantity of blood.
So he made a very important point there. He talks about the fact that 12% of heart surgeries is done by Dr. Shetty's institute in the United States. Think about that. You know, globally now, the barriers have been removed. He has a hospital set up in Cayman Islands, and
the medical college will be up and running this year. Yeah.
Correct. And the companies are choosing they find it cheaper to send out, their employees to get surgeries done to his hospital than to get it done in the United States. So can you see the opportunities available to you if you understand the role of systems, and then you can start defining, your playground once you understand this concept, how you are going to add value in a global healthcare system.
And I think this is a good opportunity for even institutions in India, whether they are medical colleges or dental colleges or pharmacy colleges. We can lead by bringing Europeans, Americans to come and work there, train them, teach them. And like right now, there are 200,000 or 2 lakh students coming out of India to America, other countries. Now, I think institutions in India, by globalizing, just like what we are doing with Siddhartha, is uniting or collaborating with colleges and universities in America, build their own skill, build their own management, build their own teaching, and become world-class teachers, world-class institutions. Then you will have Americans coming to your institutions to train. And then your teachers can come to America to train. And the management then come to USA. And the management from USA can come to Siddhartha or other institutions in India. The whole idea of building partnership is to develop a collaboration where there is exchange of ideas, exchange of training, exchange of subject, exchange of building projects together. And this way, the unique qualities from both continents, both universities, and different hundreds of people putting your skills together, you build something which is sustainable, which is helpful, and which helps lot more population than just yourself being by yourself. And that is why this effort from us, from Duquesne, is to bring all of you together, to build a bridge to India, build bridge to other countries, and build a bridge back to USA. And I hope everybody understands that together we can do that more efficiently. Thank you so much.
Yeah, thank you, Dr. Shiva. Communication and relationship management is key, and communication and relationship management does not happen, and nor do any of the other things happen without each one of you understanding your own strengths. And with Dr. Linkov and Dr. Kinsey's support, we've brought in, I have brought in Gallup's strengths-based training into Duquesne University. We use strengths-based approach. I can spend all my time telling, so I'm going to pick on Anup because I see him front and center in the screen, that all the zillion things that are wrong with you, right? Does that help Anup fix the problems? No. Or I can figure out those 5 things that Anup is really, really good at and ask him to, in every aspect of his life, apply his strengths, because none of us is perfect. And so if through partnerships, as Dr. Shiva said, if we are able to connect with each other, then you are strong where I'm not strong, and I'm strong where you are not strong. We do a better job in leading. So that's the whole vision about this. And, the world is our oyster here. We can do and bring about a real big impact if we all decide to do our bit. So here, this is another doctor of Indian origin. He spent some time in Ethiopia. He's also a fabulous writer. He's the chair of internal medicine at Stanford. Can you play this slide, Jeff?
I was a medical student in Africa. I had just begun this in this new medical school. I was full of myself. I was, in my third year and quite cocky. And overnight, my world sort of collapsed. The emperor of Ethiopia, where I was overthrown. A military government took over, and one of the first things they did was close the school and ask all the expatriates to leave. I suddenly found myself shorn of all identity. No longer was I a medical student. Not only that, I wasn't even part of this land anymore. And I made my way to America by a very circuitous and difficult manner. I had a profound sense of having missed my boat, in a sense. I was on a completely new path, and I became an orderly. I worked as an orderly in a hospital while I tried to figure out what I would do next. And it was a very profoundly damaging event at one level to my ego. But at another level, I was profoundly excited about getting out of what had been a very scary situation. Happy to be in America. I think many people across the world vicariously live the American dream, and there was a sense of arrival in something that I already well understood in a funny way. And I was getting caught up in that blue-collar life. I had money, and I worked the night shift, and I sort of enjoyed what I did. But I remember one moment spotting a medical student or rather spotting a book that a medical student had left behind on a nurse's counter. And it was the book that I had read as a student, and with which I had a tremendous relationship. I mean, I could recite passages from that book by heart. I still can. And it just suddenly awakened in me again, this dream of where I had wanted to be. And I suddenly had all the desire and will to go at it. Here I was, I would have had to start all over again. And to me, it just seemed like impossible. And yet the sight of that book awakened everything in me. And to make a long story short, I eventually finished medicine. Now when I look back, I think that the most profound medical training I ever had was in the year I spent as an orderly, in seeing what happens to the patient in the 23 hours and 59 minutes that the doctors are not in the room, and really understanding the dimensions of human suffering, and how easily one person, usually in the form of a nurse, can alleviate that by a kind word, by a touch. And it wasn't a lesson that I necessarily understood then, but it's ironic that, if you were to condense everything I do now, in a sense, it would be to help students imagine the suffering of the patient. That is in essence what I do in my writing and in my practice, and it all came about from that insight. So much about setbacks or disasters is discovering that this thing that you set your heart on wasn't really what you needed. It may have been what you wanted, but it wasn't what you needed.
So Dr. Verghese talks about some very interesting things. His story tells you he did not even know, his world was about to collapse. Most of us don't know when the powder keg around us is going to completely decimate the world that we know. And he had to leave everything behind in Ethiopia, come to the United States, and work as an orderly. I can tell you unequivocally that United States is the one country where if you have the passion to make an impact, you can rise up. Your voice can be heard, will be heard eventually. I mean, that is the one thing this country gets right. And if you come, you will be able to learn enough and make an impact, and you learn by doing. Dr. Linko shared with you, our experiential approach, right? Everything is geared towards giving you hands-on experience. And if you do that, when you learn by doing, you never forget it. So this slide that Jeff has pulled up for us, he's, explained some of this. The world problems, you can look at it from this point of view. Here, close to the origin, you're close to certainty and close to agreement. So when you're close to certainty and close to agreement, you can resolve simple problems pretty easily, right? There is a technical solution, you fix it. But as you start walking down this path and go further and further away from certainty, so things are uncertain here, and you go further and further away from agreement, most people don't agree. At the intersection of this quadrant right here is the land of chaos. In the land of chaos, you have to figure out how to create stability, look for opportunities to innovate so that you can start organizing people around you. That is where your principles of adaptive leadership come in handy. The old model of leadership, charisma-driven model, top-down hierarchical model, does not work in this land. Can you imagine what life is like in Ukraine right now? Dr. Linkov is from Ukraine. You could probably, next time she comes to give a webinar, you could talk to her about it. Things are really chaotic. There was an Indian doctor involved in there too. He refused to move out when Indian government had sent, a mission trip to rescue their citizens. He refused to come because he went, I'm going to help people over here. That's leadership. Most of the problems we face in society today are not quite in the chaotic land, but they are in the complex land. In complex worlds, only adaptive leadership works. And this is the intersection of political disagreement as well as complicatedness. So, launching a rocket to the moon, congratulations, we all did it. The Indian population has done a fabulous job. It is a complicated problem because once there is some uncertainty, but there is also mostly, you're still living in the land of agreement. So you are basically in the world of complicated. But when you are far from agreement and far from certainty, so turning around a healthcare organization, it is a complex problem. It is actually a very different kind of problem than launching a rocket to the moon. It requires all of us to come to figure out our complex truths. Who's going to give up what? And in there, things are going to get even more complicated once artificial intelligence comes to the mix. I mean, if you all know that ChatGPT passed the USMLEs, right?
Yes, correct. Yeah.
And if a artificial intelligent being can pass USMLEs, what is the value of doctors? I'm going to leave you with that thought, because here at Duquesne, we've already started kind of going, doctors, only human beings can do what human beings can do. Yes, AI is very helpful, but we have to figure a path where what are the humans capable of? Remember earlier on in the earlier slide, I mentioned that these AI systems are built on, they're trained on data that was collected by humans. And we need to figure out our data. Our students, even our undergraduate students. So last semester, last year in fall, my students in public health, they won the first prize in a poster competition on where are the deficits in the AI. And the Digital Divide project was eventually funded by a very big company here in the US called Comcast to start helping, our own communities here in Pittsburgh. How are we going to transcend that? And these are the ways in which, adventures in which we want to invite you in, because we can make this world a better place with our leadership together. Jeff, next slide. We have various ways. Dr. Linkov has shared, many opportunities with you. Dr. Heather Rosevich will be sharing more opportunities with you. So I didn't want to kind of share the same opportunities, but they're all available. We work together as a team. I mean, at Duquesne, it's fabulous to be in a community where we are all focused with our eyes on the bigger picture, that we want to create a world where none of us, I know for a fact that at some point I have the same genes as my dad, right? So I'm going to have Alzheimer's. For me, the clock is ticking. I want the doctors of today to become good leaders, because they are the ones who will be leading the memory care facilities where I may have lost my mind, and my life will be in your hands.
I'm first in line, so you better keep me in mind and don't get there earlier than me. So I request all the students and the doctors to make sure that I have a place when I'm not thinking. So I would love that. And yes, we have crossed 1 hour now. Just see anything important, or we will open it for. Go ahead.
What's
Go
the
ahead.
last slide, Jeff? Oh, yeah. We'll just end with Vivek Murthy telling us it will take 2 minutes, and then
Yeah,
we'll.
and after that, if there are any questions, that would be open, and Dr. Urmi will be answering. Okay,
Yeah.
that's fine.
And he's our Surgeon General.
Hello, everyone. My name is Vivek Murthy, and I'm the 19th Surgeon General of the United States. Thank you. And when I tell people that I'm Surgeon General, they usually expect me to tell them what to eat and how to exercise, but I'm not going to do that today. Instead, I want you to consider this. If I could tell you that there was one factor in your life that could lower your risk of having a heart attack or a stroke, that could increase your chances of living longer, that could increase your productivity at work and the likelihood that you would get a promotion, and that could even increase your success at losing weight, what would that factor be? It turns out that factor would be happiness. By happiness, I don't mean the satisfaction that comes from indulgence or from hedonism. What I mean, in fact, is the emotional well-being that comes from fulfillment, from social connection, and from love. Happiness affects us on a biological level. It lowers stress hormones as well as inflammatory markers. And in fact, even when you control for smoking, physical activity, and other health behaviors, it turns out happier people live longer. Happiness, in fact, is protective. As a doctor, I've cared for many patients over the years with a range of illnesses, from diabetes to heart disease to cancer. But I will tell you that perhaps the most common condition that I have seen is unhappiness. Unhappiness that stems from isolation, from a lack of meaning, and from a loss of self-worth. Now, you might wonder, does happiness really lead to better health, or is it the other way around? Do you, in fact, need help to be happy? And I would tell you that, in fact, it turns out that only 10% of our long-term happiness is really based on external factors. The remaining 90% is based on how we process life events and circumstances. So can we train our minds to be happy? The answer is yes. We know from research that gratitude, kindness, exercise, meditation, and social connection can be used to cultivate happiness. This can look like taking a few minutes at night to write down what you're grateful for. It can look like making time to eat dinner with your family. Or it can look like taking 15 minutes during the day to exercise or to meditate. So as we grapple with the challenges of how to create a healthier world and healthier lives, let's remember that happiness is a powerful tool for improving health. Creating more happiness in our lives and in the lives of the people around us could be one of the most important steps that we take to creating a healthier and stronger world. Thank you.
So I'm all yours for questions. Just have an open invitation to everyone that join us in an adventure to create meaning in this world. Okay.
May I? This is Natarajan from Hyderabad. I've been introduced to this group by Anup Yadav. So I want to add a point or two to what Dr. Murthy has been talking about. Happiness. If you are happy, you can make the entire world happy. But our happiness is to be defined properly. The real happiness is in finding happiness in other people being happy. We always define happiness with ourselves, our community, our own people. But then you have to go beyond that. If you can make people happy who are no way connected to you, and that will trigger a great revolution in how to be happy. In happiness of others who are very downtrodden, who are not connected to you in any way, that will give us the greatest happiness in life. And that will give you good health.
Absolutely, absolutely. I think compassion is something which we can have for every living being, everything around us. And I'm sure my experience has been right from school days, medical school days, everywhere. When we have compassion for others, we enrich our own life and we make our own life healthy. And last year, when I was there in India, I think my experience, the people who were with me, I was alone. My family was not there, but I went through heart surgery and all. The people who were there as employees, just small time employees, they were the ones who took care for me, of me for 3 months. And at 2 o'clock in the night, that boy who was the security guy who came to see me, his only thing was to keep me happy and safe. And are we related? No. But that's how, as human beings, we're all related in a way that God created us as one. And yes, happiness we have when we share that compassion with others, that joy with others. And today we want to share knowledge, we want to share happiness, and we want to all together make a world a little bit more better place than what our fathers left for us. And that is our goal. Anybody else, please?
Sure. So the doctors joining from all the locations, the forum is open. If you have any questions with Dr. Shiva, Dr. Urmi, they are here to answer. And just one request from all the doctors attending from the different locations, just put your name and location in the chat box so that we can keep a track and send you the information for further webinars as well. Thank you.
Okay, if that is it, that's fine. And we have just started the first step on Krishna Janmashtami and all. Dr. Urmit, thank you so much. And I appreciate you taking time. And Dr. Fevji, Dr. Faina, and looking forward to next week's webinar with Dr. Heather. And then we will follow more. And all the doctors in India and beyond, do not hesitate to get in touch with us. And no matter what, there are no bad questions.
Yes.
And please don't hesitate. Any simple question, big question, large question, don't hesitate. The first thing is you have to come out of your shell. Ask any question and do not be afraid. No fear. Ask.
Yeah.
And only by asking we will walk the path together. And as the bridge you see there between India and America, we will cross the bridge together, hand in hand. And then you also see the temple, Lord Balaji temple in Pittsburgh. So Lord Balaji, blessings are with us and we will walk together and we will succeed. Thank you so much, one and all. And I appreciate everybody joining this webinar. And please do not hesitate to give your feedback and how we can improve our webinars and improve our knowledge. Either way, please keep in touch and let us do. Thank you, Anupji and
Thank
Manjula,
you, sir.
Vishwanath, and all the Unidemy team, Siddhartha team, and everybody at Duquesne. Thank you so much. Have a wonderful, wonderful day in USA and wonderful evening in India. Thank you. God bless you all.